The brain controls pretty much everything we do. Our brain controls walking, talking, and eating. It regulates breathing and heart rate. It allows us to remember, make decisions, and feel emotions. So when the brain is injured, any and sometimes all of those things can be affected. Life itself can be affected. As we honor Brain Injury Awareness Month, we'll speak with one of the leading experts in the world on brain injury awareness, diagnosis, and treatment, Dr. Gregory O'Shanick. His patients call him Dr. O.
The key issue with brain injury is kind of a very sad fact. 50% of individuals ignore a suspected concussion, which is a devastating indictment of what we as a society have done. When in doubt, go get it checked.
Welcome to the Brain Injury Awareness Project podcast presented by Brain Injury Services. We're a nonprofit leader in delivering services for children and adults, including veterans who have experienced a brain injury. I'm Erin Mattingly, a speech pathologist and the board chair of Brain Injury Services. And whether you're a brain injury survivor, family member, friend or caregiver, a clinician or researcher, or if you just want to be more aware about injuries to the brain, we're pleased to have you join us for these conversations.
Even on the hard days, I'm not giving up.
This broadcast may contain general information relating to various medical conditions and their treatment. Such information is provided for informational purposes only and is not meant to be a substitute for advice provided by a doctor or other qualified healthcare professional.
There's still more story left to write, so I'm not giving up.
250,000 people are hospitalized in America every year with traumatic brain injuries. Millions more don't even go to the hospital to be checked. Those of us who work with Brain Injury Services see every day that knowing the warning signs and knowing what to do after a brain injury are the critical pieces to moving forward. In other words, when it comes to brain injury, awareness is the first step. And so I'm honored to be joined on this Brain Injury Awareness Project podcast by Dr. Greg O'Shanick. He's been the medical director of the Center for Neurorehabilitation Services since 1991. He was the first national medical director of the Brain Injury Association of America and is now its medical director emeritus. He's written more than 100 publications and has more honors than we possibly have time to run down. And I might add, as you'll see, his patients revere him. Dr. O, thank you for joining us.
Thank you very much, Erin. I appreciate the opportunity to be with you.
We'll also talk today with one of Dr. O's patients, Katie Schnicker, to hear a mom and a brain injury survivor's take on living with a brain injury.
If you feel like something is wrong, advocate, advocate, advocate. Don't give up.
Let's start by taking a look at the awareness side of brain injury. Dr. Rowe, what should people be aware of when it comes to brain injury?
The key issue with brain injury is kind of a very sad fact. 50% of individuals ignore a suspected concussion, which is a devastating indictment of what we as a society have done. Growing up, playing football, falling off a bike, we basically were taught to minimize those kinds of things. Now, if we scraped a knee, if we twisted an ankle, we got it looked at. We fell out of a tree, not on our head. We fell off of our bicycle and saw stars. Well, that's okay. Just shake it off. It'll go away. I think that the take home here is this is a common injury. And unfortunately, because it's common, people tend to take it not seriously.
Makes sense. And are there signs of injury that are obvious, signs of brain injury that are obvious?
The most common thing is first a headache, and some sort of alteration in how the person is operating in behavior. It may be irritability. It may be lethargy or being sleepy. It may be grouchiness. It may be, in severe cases, being unconscious. It may be somebody who has a seizure. Those are pretty obvious to everybody around. The things that are more subtle are dizziness, or problems with, as we saw on the football field several months ago, problems with ataxia, with losing your motor control, with not being able to coordinate your movements, with being lightheaded, with having double vision. with losing your ability to speak clearly, slurring your words. Unfortunately, if somebody has been imbibing in alcohol or substances of abuse, that may be difficult to determine. Are they intoxicated or did they just have a head injury? Well, when in doubt, go get it checked.
Okay. Yeah, good advice. And does it take a lot of high-tech equipment to diagnose a brain injury?
The way that you check for a traumatic brain injury or a concussion is simply by asking questions, observing, and examining the patient. You find out, A, was there some sort of blunt force trauma to the head, or was there some sort of an acceleration-deceleration event that happened to the upper part of the body and the head? Think shaken baby syndrome, think whiplash, think crack the whip when you're playing it on ice. And then, as a consequence of that, is there a change in neurologic function as we talked about? Is there an absence of memory? Is there some sort of what's called post-traumatic amnesia? Is there being dazed, confused? Is there some sort of disorientation that occurs? Even if it's transient, even if it's only momentary, you ask the person, where are you? And they can't recall. What just happened? They can't recall. Those are the subtle kind of indicators that we then need to look at and that we use clinically to then inform us. Not everybody necessarily needs to have more advanced imaging. And so we need to be thoughtful. We need to take the time to do a careful examination as clinicians to understand what's going on.
Okay. And I know I may be aging myself here, but back in the day, there was always discussion after a potential concussion. You want to make sure you don't let somebody sleep unattended, or they need to rest, but they can't be unattended. Is any of that still true? What kind of things do you need to look for after you might have suspected a mild traumatic brain injury or concussion?
Well, clearly, back in the day, we were all told, if somebody goes to sleep, wake them up every 2 hours. And the concern there was, did they have some sort of a blood clot or some sort of brain swelling that was expanding and that from which they couldn't be awoken? In general, what people are more thoughtful about now is that the individual does need to have rest. And certainly if you're going in every couple of hours to wake them up, that is not going to be necessarily the best thing for them. But, if somebody has been injured significantly enough that would be advice, they're going to be in the emergency room getting a CT scan anyway. They will have been looked at to see if there's any kind of leakage, to see if there's any kind of blood clot formation. So in general, rest is important. You want some in that first 24 or 36 hours. You want cognitive rest. You want rest away from the computers and the iPhones and all of the kind of electronics that inundate us all the time, because the blue spectrum light that emits from all of that is too stimulating to our brains. The 60 cycle per second fluorescent lights are too stimulating. So you want to downplay that at least at the start. And then we know that what's important is getting graded exercise, that walking outside, being active, sleep, hydration, nutrition, exercise.
Yeah, I think the rest piece has been so interesting in looking into what the research is now showing about the importance of rest, but also not resting too long. So getting back into that graded, return to play, return to school, all of those kind of things. I think that it's changed for so much over the years.
Exactly. And one of the things that we found out didn't work was we used to keep kids away from other kids. And all that did was contributed to more depression, more isolation. And those children ended up having worse outcomes because, adolescence and childhood is about your social connections. It's about being with your peers. And by separating them from their peers, it only extended their period of disability and extended the distress. So being able to get them back in and involved in some way, shape, or form with limited amounts of peers, not opening the floodgates completely, but being able to engage back becomes really therapeutic.
Yeah, absolutely. And why does it even matter if we're aware of what a brain injury is in ourselves or in someone else around us? We've talked about some of the awareness pieces, but why is it important to recognize for other people?
Well, you know, concussion and mild traumatic brain injury are called that because thankfully the vast majority of people do recover from that. However, it also, we know that there is a cumulative effect to those. So it's like taking a little bit out of your bank account each time. And we also know that there are certain individuals who do not recover completely. If they have some sort of pre-injury vulnerability, if they have other types of medical issues, if there are other kind of conditions that occur in terms of how they hear, auditory processing, visual processing problems, other things that complicate the recovery. So we need to be assured that, number one, the recovery is going smoothly. Number two, the individual is not put back in harm's way so that they can be re-injured. Number three, that some of the subtle information processing deficits that exist don't contribute to reducing their margin of safety in terms of being out and about. For example, if you have difficulty with sound localization and you're out trying to cross a busy highway, you're not going to be able to localize if somebody honks a horn. And that puts you at increased risk for getting hit. So it's subtle kinds of things of that nature that we might not normally think about that then increase the risk for further injury.
Okay. Great point. And one misconception about brain injury and concussion that we want to clear up is that it's only or even primarily something that only happens to athletes.
He banged his head on the field and was unable to walk.
That's not a good sign.
Like Tua Tagovailoa, 3 concussions on the football field this season.
Another hit caused his head to slam against the turf and his hands to freeze up.
Or the fears the world shared that the Buffalo Bills' Damar Hamlin might have suffered neurological damage when his heart stopped after a routine-looking play.
Let's hope that he's going to be okay.
But brain injuries of all kinds can happen to anyone. A car crash, a simple fall, or even with your family at a holiday picnic.
As the show came to an end, there was a feeling something was terribly wrong.
They're running away. In 2007, I took my kids to our town's local fireworks show. They were ages 3 and 7 at the time. And the fireworks, it was an amazing show. And I remember my 7-year-old at the time, he and his friend were rating the fireworks on a scale of 1 to 4. And it was just great. And then all of a sudden there was a blast and everything is pitch black. And what I learned later is that a 3-inch mortar misfired and it shot through the crowd and landed on, it hit my friend and then landed on me. At that point, I had my youngest son in my lap at the time.
It was just chaos.
At a news conference,
To give you an idea of the size of the firework, I think you think maybe it was like the fireworks that you pick up at Costco or a roadshow, but it was a 3-inch mortar, and the force of the blast was strong enough that I had button-fly shorts on that evening, and they were actually impaled and had to be surgically removed from my thigh.
2 people still remain hospitalized, and we should put...
It was catastrophic, I think is probably the best way to say it. So I was actually medevaced from the scene in Vienna and spent 12 days at the burn unit at Washington Hospital Center. And the time in the hospital was really overwhelming and confusing because I had multiple injuries from my head down to my knees. And my eardrums were blown out. I couldn't hear. So it was just really, I had a lot of medical teams coming in and it just felt really disjointed. I remember my doctor came in and said he was sending me home, and I just thought, like, I really want to go home. I know I have 2 little kids that I have to take care of. I'm, as a full-time mom, and I just thought I'm not ready for this. But I went home, and I went home with the nurse who, took care of all my wounds and my bandages. And we sort of, pieced ourselves back together physically that summer. And I kind of looked forward to the start of the school year with the kids because I sort of imagined that was, starting the next chapter and we could put the accident behind us. And it was as I was slowly getting back into trying to drive and taking my kids to school and going to the grocery store that I realized that I was not functioning the same way that I had before. I would go to the grocery store and, in my head, I'd always been able to have a running list of what my household needed. And I would go to the store and buy things that we didn't need and buy multiple things and completely forget what I did need to do. I took my kids to school on days that they didn't have school because I couldn't keep track of just, the routine of running the household. And I didn't want to get out of bed. I was just really struggling. It was just really hard. And I went to my primary care doctor and talked to her about the fact that, I can't calculate the tip on a restaurant bill anymore. And I'm just like, I'm not okay. Like everyone keeps, and I think also the hard part is that because I had so many physical injuries, everybody around me kept telling me that as I was feeling like, you're doing great, you look great, and I was like, okay, I have to live up to this expectation that everyone is telling me that I'm okay. And I couldn't, I was failing at everything. And so I went to my primary care doctor and she said, you're depressed. And it was like, okay, yeah, but gosh, I feel like there's something else going on. And it was just it was hard. It was very hard. Yes, I was depressed and I got treatment for that, but it was so much more than that.
Yeah.
That I was struggling with.
Well, it's so interesting, Katie, because, we just talked about with Dr. O is the awareness piece, right? And the fact that you had a severe, as you said, catastrophic injury, and yet your brain injury went undiagnosed in the hospital. That is stunning to me, just because of everything that you went through.
Yeah.
Nobody picked up on the aftermath except for the physical injuries. Nobody looked at the blast injury.
I had so many serious injuries. I had multiple surgeries, in the hospital, and after I got out of the hospital and sort of, like they were triaging me, right? And so I think that TBI was very low on the pecking order in terms of my immediate cares. And I think the other thing that I realized also is that the hospital's job is just to stabilize you, right? And that was a shock to my system because, I thought you can't get out of the hospital and like, you're good to go. Right. And so I think that was also coming to terms with that of just sort of, this is just the beginning of the recovery process. And it was through one of our therapists that sort of connected the dots for us with some of the cognitive struggles and finally made the connection that there was a possible TBI.
I'm lucky to work alongside Katie at Brain Injury Services, where she's now the outreach and advocacy manager, helping others in and around Northern Virginia get the brain injury services they need for their paths ahead, the services that she did not initially have. So that's why it's so wonderful to have her on staff. She's lived it. She understands the value of it and the need to the community. And while you might say luck for Katie would have been no brain injury at all, she considers herself lucky to be a patient of Dr. O and to be helping others work through what she's been and is still going through. So Dr. O, while every patient is different, of course, what can and what doctors and specialists do, what do you do for brain injury patients? Where do you start?
A very wise neurologist back in the 30s said it's not so much the kind of brain injury that happens as much as it is the kind of brain that's injured. So what we first need to start out with is finding out who the person was to begin with. Who were they? What were their strengths? What were their desires? What was their trajectory of their life? How resilient were they in terms of things that happened to them? How did they problem solve? So we look to see what the individual's strengths and assets were before. We look to see what their liabilities were. Was there some sort of a chronic illness? Was there some sort of a history of depression? Was there some sort of history of some sort of medical issue? What kind of support network do they have? And what other kind of challenges do they have? So you really do need to take a comprehensive view. And our process is one that is time consuming. Our initial evaluation takes 4 to 6 hours of face-to-face time. But at the end of that time period, we have a good comprehensive understanding of who the person is, what their strengths are, where their deficits are, because we've done cognitive exams, neurologic exams, we've talked to the support systems, the significant others, etc. And then we can construct the kind of treatment plan that's comprehensive to look at what do we need to do biologically to support them, what do we need to do in terms of cognitive therapies, emotional therapies, psychological therapies, etc. So, and it's also the idea that this is a journey. This is not like a sprained ankle. This is not something that we're going to tape up and that's going to be it. This is something that is much more like diabetes. It is a disorder that is going to be with you to greater or lesser degree, and you're going to learn to manage it. My goal is to have people not need me. And so I want to educate them as much as possible about where the problems are, all the different things they can do to self-manage, and then send them on their way. Periodically, something changes. Sure, you come back and we look at it and we tweak it and we do a booster shot, and then we send you on your way again. And so that's kind of the difference in terms of brain injury medicine, which is the subspecialty that we practice, and other disciplines where people treat it as just, oh, we're just going to put a Band-Aid on it. This is about self-management. This is about, your lifelong living and your trajectory and taking care of yourself as you age, as you go through life.
And Katie, do you remember kind of being a part of that initial evaluation session and setting goals with the team?
To have like some very simple task presented to me that I was not encountering on a day-to-day basis and how impaired I was, because I think I was trying to do a very good job at covering up for everybody else. And that was like very much in my face of like, oh, wow, you only know 3 animals.
Yeah. So you're right, Katie, because one of the things that we look at is, the brain develops in a certain pattern. And after injury, the deficits that occur kind of go back and reenact those patterns of development so that we can do a lot of the things that we would expect a child to be able to do at age 4, at age 6, at age 8, at age 10, etc., and identify where stalls are, where problems are based upon that. And so, part of the exam, as you say, are things like your vocabulary. How many animals can you name in 60 seconds? Seems kind of simple, seems kind of trivial, but it involves your ability to organize, your ability to think on your feet, your ability to stay focused on a given set that you are trying to maintain. It involves your ability to remember what's the animal I just mentioned. And that's right. And then we do things in terms of looking at motor skill. If all of a sudden we are moving, as we move one hand, the other one is kind of imitating those movements. Well, that means that our ability to suppress that other side is not functioning appropriately. Well, is that really a huge thing in the grand scheme of things? Well, yes, because it means that your brain is not putting the brakes on in a developmentally appropriate way. And so if it's not putting the brakes on there, you're also not able to inhibit, chances are, in terms of verbally, or you're not able to inhibit in terms of your behavior, or you're not able to inhibit when you start talking and you can't know when to stop. When have I said enough? So those types of subtle kinds of examination strategies give us information and also are illustrated to you, Katie, to the patient, that things aren't perfect. Yeah, they tapped on my knees, I'm fine. Yeah, they asked me to walk back and forth, and I'm fine. Well, okay, yeah, you can do that. But these higher level things, these more subtle things, are the things that allow you to function at the higher level that you do as a mom, as a worker, as a spouse, as a citizen, all of those kinds of things all those other jobs that we have as adults.
Yeah. And Katie, what do you want parents and kids and teachers and adults to know when it comes to a possible brain injury, or going back to the awareness piece?
That's a great question. I think if you feel like something is wrong, advocate, don't give up. Because I was told countless times that, there's nothing else I can do for you, or you're depressed. And it was, just through persistence and perseverance of just knowing that I'm not done yet, and just working hard. And finding people that support that.
Yeah, and that kind of ties into something we've talked about a lot on this podcast, which is the hope component. So, we know there is no cure for brain injury, but there is hope. No matter what phase you are in the brain injury cycle or process, whether you've just sustained it or whether you're down the road. So that's really, really important. So thank you, Katie, for kind of reinforcing that.
There's always hope.
Always hope. So if I can recap here, be aware of the possibilities of brain injury. It can happen to anyone. Ask questions of your medical providers if you think you or one of the important people in your life may be struggling with a brain injury, just like Katie did.
I want to underscore the fact that even people who have other types of disabilities and challenges can also sustain traumatic brain injuries and concussions. An individual who has autism spectrum disorder, an individual who has some type of intellectual disability, an individual who has a visual disability or a hearing disability or something of that nature, just because they have another type of dysfunction does not mean that they cannot have the additional burden of an acceleration-deceleration concussive injury. And too often that gets overlooked in the smoke in the room of the primary dysfunction. And that is a huge disservice in terms of those individuals, in terms of their quality of life. So I want to make sure that we don't lose track of that.
That awareness needs to be there, because I think you're right. They're not mutually exclusive. And you're right. People focus on the primary disability, perhaps. And that's a really, really good point. Thanks for raising that. Is there anything else that you want to raise or sum up here as we end the podcast?
I just really am very excited, and I'm personally very proud to have been a part of Katie's journey. We just set the table for her. She's the one who took it and ran. And to see her be in a position where she is now facilitating other people's growth, and she's got as they say, the street cred to relate and to let people know what it's like. And depression, yes, is a part of it. You don't change. Your world does not change in an instant and not have grieving and depression be a part of that process. But it's not simply that you're down in the dumps. And no one should let their providers or whoever is their environment convince them that that's all that's there. And I certainly, like I said, have been honored to be a part of Katie's journey.
Oh, thanks. That means a lot. My accident was big, and it should have been obvious that I had a brain injury. But I think what's also really important to remember is it doesn't have to be a big event to sustain a concussion or a traumatic brain injury. It can be something quite simple, and to not dismiss it if you are noticing any of the symptoms that we mentioned before.
And Katie, can you give us a little bit more about the services that we provide at Brain Injury Services? What kind of support do we provide? What kind of work do you and the rest of the team provide to our community?
So Brain Injury Services really, number one, just gave me an outlet of people that were similar to me, who had the same struggles, and that was invaluable. I didn't know that I needed that. And then through their volunteer program, I was part of the Speakers Bureau. So I actually went out and I shared my story, and that was so empowering. And also just, it gave me back my confidence that was, at below zero. Other clients come in and they really need help, with much more day-to-day living supports. And so our case managers really sort of work with that individual, and together they come up with goals. And from those goals, they'll either look at the programs that we have in service, and we do have mental health counseling. We have occupational and speech therapists on staff. We have vocational and volunteer placement support as well. So it's and if we don't have something in-house, then that's where we will go and connect people to the outside resources and get them connected to other providers that might be able to do that. But it's really every person that comes in here is going to have a different experience when they come through the door.
That's great. Yeah, great point. And again, kind of tying us back to the theme of awareness, right? Awareness of yourself, awareness of injuries as a whole. So thanks, Katie, and many thanks to you and to Dr. O'Shanick, not just for joining us today, but for all that you do for everyone to help us to raise awareness and work through injuries to the brain and support the people who have sustained brain injuries. So thank you so much to both of you. I really appreciate your time.
Thank you.
Thanks, Aaron. Thank you very much. Thanks for having me.
Let me also mention some places to get more information. The Centers for Disease Control and Prevention is a great website at cdc.gov/headsup. That's cdc.gov/headsup, and heads up is spelled as one word, no space or punctuation. Dr. O's Center for Neurorehabilitation Services is online at cns-va.org. That's cns-va.org. And then the Brain Injury Services website at braininjurysvcs.org. Again, that's braininjuryservices.org. And check out all of our Brain Injury Services Awareness Project podcasts and reach out to us here at Brain Injury Services if we can help. We also welcome you to volunteer and partner with us. And know you can support all of our work and all of our people at braininjuryservices.org/donate. I'm Erin Mattingly. For all of us here at Brain Injury Services, wishing you good health and healthy awareness about the brain.
I won't pretend that it's been easy, but I won't let this beat me. It's not the end, it's not the end for me.
This broadcast may contain general information relating to various medical conditions and their treatment. Such information is provided for informational purposes only and is not meant to be a substitute for advice provided by a doctor or other qualified healthcare professional. Listeners and viewers should neither use the information contained herein for diagnosing a health or fitness problem or disease, nor for assessing one's treatment options and/or regimen. Any listener or viewer should always consult with a doctor or other healthcare professional for medical advice or information about diagnosis and treatment options. Neither Brain Injury Services Incorporated nor any party involved in creating, producing, or delivering this broadcast shall be liable for any damages, including, without limitation, direct, incidental, consequential, indirect, or punitive damages arising from the use of said information contained in this broadcast.